You're sitting in a waiting room, and a nurse hands you a form asking about your anesthesia preferences, local or general. A small comfort you probably never think twice about. Now imagine that same procedure, except the only thing standing between you and the pain is a cup of strong wine and four men holding your arms down. That wasn't a horror story. That was Tuesday for a medieval surgical patient. It's tempting to picture medieval surgery as pure butchery, performed by men who barely understood anatomy. The reality is stranger and more impressive than that. These surgeons operated without anesthesia, without antibiotics, and without any real understanding of infection. And yet some of them were fast, skilled, and methodical enough that patients regularly walked away alive. Start with who was actually holding the knife. Surgery wasn't performed by university-trained physicians who considered manual work beneath them. It was performed by barber-surgeons, tradesmen who cut hair, pulled teeth, and operated on bodies, all within the same profession. They trained through apprenticeships, learning by watching, assisting, and eventually operating themselves. Guy de Chauliac, a 14th century French surgeon, wrote a text called Chirurgia Magna, the Great Surgery, one of the most influential surgical manuals in Europe for the next 200 years. He documented wound treatment, fracture setting, even early hernia repair, in careful detail. He wasn't working from superstition. He was working from direct clinical observation, refining his methods based on what actually worked on real patients. Around the same time in England, a surgeon named John of Arderne built his reputation treating anal fistulas, a painful and often fatal condition among soldiers who spent long hours on horseback. His technique was so effective that wealthy patients across the country sought him out by name. He wrote down his methods in exacting detail, including sedative dosages, making his work one of the earliest examples of a surgeon documenting his own success rate. Speaking of sedation, medieval surgeons weren't operating on fully conscious patients as often as you might assume. Some used a soporific sponge, soaked in opium, mandrake root, and henbane, then held under a patient's nose before surgery began. It wasn't reliable, dosing was inconsistent, and the line between sedation and poisoning was dangerously thin. But it existed, and surgeons like Chauliac wrote specifically about its use and its risks. Now picture the procedure medieval surgery is most associated with: amputation. Losing a limb to injury or frostbite was common, especially among soldiers. And here's where medieval skill becomes remarkable. Speed wasn't just a preference, it was survival strategy. A surgeon who could remove a limb in under a minute dramatically reduced blood loss and agony, both of which directly affected whether a patient lived. Surgical texts described tourniquets applied above the wound, a single decisive cut through tissue, then a saw through bone. To stop the bleeding, surgeons had two main options. The first was cauterization, pressing a heated iron or boiling oil against the wound to seal vessels shut. The second, championed by advanced surgeons like Chauliac, was ligature, tying off vessels individually with thread, a technique closer to what modern surgery still uses. Ligature caused less damage and better outcomes, but demanded more skill and steadier hands. You'd expect all of this to end in near-universal death. It didn't. Bioarchaeologist Piers Mitchell, whose research at the University of Cambridge has examined skeletal remains from medieval hospitals and crusader battlefields, has found bones that healed cleanly after amputation, proof that patients survived and lived on, sometimes for years. His work also uncovered organized post-surgical care, clean linens, controlled diets, and separation of patients by condition, suggesting medieval caregivers understood, even without knowing why, that cleanliness and rest improved outcomes. Here's the detail that should genuinely surprise you. Some medieval hospitals had amputation survival rates comparable to, and in documented cases better than, military field hospitals during the early American Civil War, 500 years later. Speed, skilled hands, and a surgeon who had done the procedure hundreds of times sometimes outperformed later medicine with more tools but less individual technique. So why does any of this matter now, sitting in your anesthesia-equipped, antibiotic-stocked hospital? Because it reframes what these surgeons actually were. Not butchers guessing in the dark, but skilled tradesmen operating at the edge of what the body could survive, refining their methods one patient at a time, writing it down so the next surgeon wouldn't start from zero. Chauliac's textbook was still taught 2 centuries after he died. Arderne's technique remained in use, essentially unchanged, into the modern era. Every time you go into surgery today and wake up with no memory of it at all, you're standing on the far end of 1,000 years of surgeons like these. Men with no anesthesia, no antibiotics, and no understanding of germs, who still saved lives by paying obsessive attention to speed, technique, and the patient in front of them. You're sitting in that waiting room again, filling out your anesthesia form. Take a moment before they call your name. Somewhere behind that simple choice is a surgeon with a heated iron, a sponge soaked in mandrake root, and a patient who lived to tell the story.